Welcome to our webinar series on women who inspire at the forefront of healthcare. Today, we will hear about the challenges and opportunities of schooling from home during the COVID-19 pandemic from our faculty experts in the field, who I will be introducing in a moment. This conversation will focus on recent research of parents' experiences with schooling from home. We will consider the potential impact of children's learning, as well as how this new environment may be affecting families, not only in terms of their eating habits, physical activity, social connectivity, and mental health. We invite and encourage all of you, our audience, to ask provocative questions that will generate ideas, especially around opportunities for resilience and strategies to help families overcome the many obstacles yet to come. Before I introduce our panel of experts, I would just like to acknowledge the planning committee for this webinar and specifically ask our colleague Crosby Enright to give us a brief summary of the ground rules as we get engaged in this webinar. Crosby, please.
Thanks, Carmen. Welcome, everybody. As we settle in, we just wanted to share a few best practices and notes for this event. We are recording this, and the recording will be circulated afterwards. If you've joined from another device, such as your iPhone or your iPad, we ask that you please try to rename yourself, listing both your first and last name, just so we know who's with us today. To raise a question or a comment, please use the chat window. You can type your question or comment there at any time, and we'll address it during the Q&A portion, the second half of the event. I'll also be monitoring the chat window in case of tech questions or issues such as that. During the Q&A portion, I'll be reading out the questions in the order that they're received, and when your question or comment is raised, you're welcome to unmute yourself at that time. As a courtesy, we do ask that you please remain muted unless it's your time to speak. You're welcome to leave your webcam on for the duration of the event. It would be great to see everybody's faces, however you do not need to. And with that, I'll turn it back to Dean Sheppa and our speakers.
Thank you, Crosby. So I'd like to introduce Christy Rizzo, Associate Professor in Applied Psychology, and so that she can introduce herself and from there introduce our other faculty experts. Christy.
Thank you so much, Dean Sheppa, and thank you so much for this opportunity to come together to talk about schooling from home. I think there's a lot of interest in this topic right now. I know the four of us have been talking about it for quite some time, so we're really grateful to have this opportunity. So I am an associate professor in applied psychology, and I'm also a licensed clinical psychologist and clinical researcher. My focus in my research is really around prevention, specifically focused on preventing risk behaviors among adolescents. So I develop interventions that are both online using technology and also in person. And in addition to that, I'm not just, my work isn't everything. I'm also a parent to a 9-year-old daughter, Maisie, who has been schooling from home these last few months and is right as we speak doing some virtual camp. So I very much relate to this topic, and I'm going to hand it over now to Dr. Breach.
Good afternoon, everybody. I'm Amy Breach. I'm an associate professor in the school psychology program at Northeastern. And my research is broadly focused on how do we identify kids who are potentially struggling with mental health or behavioral issues in schools early on, and how can we identify feasible strategies for teachers to be able to implement to try to change some of those trajectories down the way. And I have a 3.5-year-old preschooler at home, Persephone. Go to Robin.
Hi, I'm Robin Cotting. I am also an associate professor in the school psychology program. I'm interested in the application of evidence-based practices in education to address the learning needs of all children. And in particular, I'm interested in addressing the needs of students who experience learning and attention challenges. And like the other panelists here, I have 3 children at home. I have 10-year-old twins who are entering 5th grade and a 4-year-old who's entering pre-kindergarten. So turning it over to you, Dr. Hoffman.
Hi everyone, my name is Jess Hoffman, and I'm really glad to be here with you today in this forum. I am a licensed psychologist and a nationally certified school psychologist, and my program of research focuses on the promotion of children's healthy eating and physical activity behaviors. So I develop interventions that are implemented and tested in school and community centers. And on a personal level, I have 3 kids who I've been schooling from home this spring. My kids were in kindergarten, 1st and 4th grades. And it was a tremendous difficulty, this experience. My husband and I both have full-time jobs, and the fact that 2 of them are young and required a great deal of support and did not have a lot of independence with remote learning made things really challenging. So I'm very interested in this topic, and I'm glad to be here with you today. I also wanted to say that during our conversation today, we're using the terminology schooling from home instead of homeschooling intentionally. And that's because what we're doing in terms of this experience schooling from home is very different from homeschooling. People who decide to homeschool their children do so with a great deal of forethought and planning. They've determined that they have the time to dedicate to school their children, to homeschool their children. And the homeschooling experience also involves typically a lot of interaction with other kids in person. So for those reasons, what we're talking about, schooling from home in the COVID-19 era, is different. So I just wanted to let you know that we're being intentional with that language. So with that, I'm going to hand it over to Christy, who's going to get us started.
And so I just wanted to really kind of set the stage for our conversation today. First, just recognizing that schooling from home during COVID-19 has been incredibly complex. It has highlighted both opportunities, but also, unfortunately, some failures in some of the interconnected systems that affect youth and families. And so we really wanted to create a dialogue and talk about this, recognizing that there's a lot of uncertainty ahead. So we are faculty both in counseling psychology and school psychology. As we all have shared, we are parents of children who we have schooled from home. And so both our professional and personal work is kind of at the center of this crisis. So with that, our goals for today are threefold. First, we're going to talk about some research that we have done, a national survey of parents around their experiences with schooling from home. Second, we're going to talk about the impact of stay-at-home orders and schooling from home on families, with a particular focus on academic progress of kids, physical progress, and also social-emotional impacts. And third, discussing research and practice in terms of next steps. So, I will speak to, some of the challenges for sure, but I want to make sure that we spend some time today really talking about ways we can promote resilience in families, opportunities to kind of overcome some of the challenges that we're facing, and really hopefully give folks some tips. So with that, I wanted to hand it over to Dr. Breach, who's going to talk a little bit about the first goal, which is some of the research that we've done recently.
Thanks, Christy. So my goal here is just to provide a little bit of context. This is was a big survey, and there are a lot of pieces to it, and we are hoping to have a full report that will be out soon for people who are interested in finding out more. But I want to lay the foundations in terms of the why and the who and the what of this survey, and to give you some basic grounding at the beginning. So you heard, we were all full-time working parents who also had young children at home and trying to navigate this schooling from home situation, and had a lot of conversations amongst ourselves, as well as conversations with family members and with friends, and reading social media posts and articles in the popular press. And it was very clear very quickly just how different the experience was for families depending on where they were, whether, across different states and within different school districts. The expectations and the supports looked very different. And we thought it would be really interesting to be able to essentially capture a snapshot of where the country was with regard to this schooling at home experience. So understanding, for one, what does a typical day look like for kids and families during this period of time? And then what are some of those barriers and obstacles that have been encountered as people are navigating this context? So that was sort of our goal from the outset. We wanted to get a large sample, and we wanted to try to do it quickly because we knew that, we didn't have that much time until the school year was going to end, and the further people get away from that experience, the harder it is to recall. So we had used Facebook as our primary method of trying to contact people, and we had the survey out for a couple of months, May and June of this year. specifically aimed at families who had kids who had been in K-12 brick and mortar schools pre-COVID. So as Jess had said, we weren't interested in folks who were deliberately homeschooling already, but those folks who were having to do this pivot schooling. Ultimately, we got responses from about 1,000 individuals from across 44 states. So we were really happy about the geographic representation there. The majority, over 80% of parents had kids who were in public schools, which is consistent with statistics at the national level. And the sample was definitely a little bit more weighted in terms of elementary age kids. So we had about 40% of the parents were reporting on kids who were in kindergarten through second grade, about a quarter in third through fifth grade, and then much smaller percentages, about 15% roughly each, in middle and high school. So we did have representation across those different age levels as well. And then the other thing just to note with regard to the sample was that we were trying to, we used procedures to try and get a larger percentage of parents who had kids who had been struggling either with academic or behavioral issues to try to understand the supports that those particular students were getting. So we ended up with about a third of the sample where parents were reporting their child had had one of these challenges, and about 17% of those kids were actually receiving special education services, which I'll talk about a little bit in a second. So as I said, our goal, one of our goals was really to try and understand just what does this daily life look like during this period of COVID closures. And there are a lot of statistics that we are still sort of sorting through, and I tried to pull out just a couple of them that I thought helped to highlight some of the discrepancies that exist out there. One of the things that we had focused on was trying to understand what does instruction look like. These terms have come into many of our vocabulary that may not have been there before, in terms of the idea of synchronous or simultaneous instruction, where we are forward taught a lot opposed to asynchronous, where a student, for example, might be watching a video or doing something that's not in real time. And what was interesting is 1 in 4 parents reported that there was no expectation from the school with regard to synchronous instruction. And that held up across grade levels. So it was the same at the elementary level as it was at the high school level. And that's not to say that if there isn't synchronous instruction, that instruction isn't happening. There are certainly a lot of parents that were reporting that the school and the teacher had provided pre-recorded lessons, videos, different materials for students to engage with. But clearly there's something very different about an experience where there is no direct interaction between the child and the school versus our typical school day where a kid is with the teacher for 7 hours a day. So that was very striking. There was also a lot of variability with regard to even what independent instruction looked like. There were 9 in 10 parents were saying that their child was assigned less than 3 hours of work a day, and at the elementary level, and it was only slightly higher at the high school level. And so you think about this again too, in comparison to the number of hours of instruction that are typically happening in our schools, that there's a big discrepancy there as well. And when we asked parents sort of qualitatively to talk to us about what were some of the things that the school did right, or what were some of the challenges that you thought arose that the school could have navigated better, that was one of the big things that came up, was with regard to this ability to connect, the ability to have some sort of synchronous interaction. And people were saying, when things went well, they credited it to the fact that there were lots of connections between the teacher and the students. And when things didn't go well, often parents were talking about the fact that it was difficult to make those connections. So clearly, parents placing a lot of value on that direct interaction, both with regard to the ability to instruct, but also the ability to connect with the teacher and with other kids in that classroom. So these are sort of concerning, especially in light of some of the research that's been coming out recently, talking about the fact that only 1 in 5 schools have really met the standards for rigorous remote learning, and that those schools who have greater level of resources are more likely to be able to meet those standards. clearly that seems to be reflective of this issue. We're seeing that there's a lot, from one school to another, the expectations in terms of both synchronous and asynchronous instruction varied very widely. As a result, it's not surprising that 1 in 4 parents in the survey were reporting that they were concerned, either somewhat concerned or very concerned, that their child was going to enter the next school year being behind academically in relation to their peers. And these problems were intensified further with those children who were receiving special education services. It was incredibly disheartening to read through some of the comments that parents had shared with us about having not received any special education services while the schools were closed, or only after they had placed repeated demands on the school. Obviously it's a concern for kids who, are trying to just access the regular curriculum. These kids who have additional special needs, whether they be learning or behavioral needs, and weren't even getting sort of the baseline level of support from the school in some of these cases. And this was really striking, particularly in light of the levels of satisfaction that these parents had expressed with the school prior to COVID. So almost 90% of parents were saying before all of this started, they were really happy with the services that their student was receiving through the school. But once these COVID closures happened, only about 1/3 of those parents still were satisfied with the services that had been provided. So there's a lot of implications for students in terms of their academic growth and their social emotional health that we'll talk about a little bit more later, but also obviously implications related for parents in terms of trying to navigate this situation. I think a big implication is when you think about how little was sort of being prescribed in a lot of cases for children during the day, it left a lot of room for parents to try to figure out what to do, whether it's trying to help their children access instruction or just structuring their day in some way so that they have something to do. There were a lot of stresses that were placed on parents. We've seen in other popular press articles, lots of challenges that parents have faced in these periods of school closures. But the biggest one in this sample that was reported, with about 2/3 of parents were saying they just didn't have enough time to be able to help their children to be able to access instruction during these closures. Related to that, it's interesting to note that, probably not surprisingly, the large majority of respondents in the sample were mothers, or about over 90% were mothers, and 61% of them were working from home and 11% working from outside of the home. So the overwhelming majority obviously were trying to do a job either inside the home or out. And so really struggling to navigate the situation. We know that work-life balance during this period of closures was really, really challenging. And there was a recent New York Times article that had even described schooling from home as a crushing burden that's destroying careers. I mean, this is intense, but realizing that there's just so much time in the day that is available to be able to navigate these different responsibilities. And so it's really caused a lot of stresses on families that we'll talk a little bit more about later on. So we're still in the process of going through a lot of these data, trying to sub-analyze them to understand the experiences of particular populations. We know, for example, that families who have younger children who are less independent, children who have these learning or behavioral needs, parents who had to be outside of the home because they were essential workers during this period of closures probably were experiencing even higher levels of burden than other families. And so we're in the process of starting to look at that. So stay tuned on that piece. And then the last thing I just want to say is acknowledging the fact that this sample, part of the issue in using Facebook is we end up with a sample that is not necessarily perfectly reflective of the national populations. We do have a sample that overall was more highly resourced, I think, than the average family in the United States, but we were still seeing the large level of concern that we were. Only 11% of the families in this sample, for example, qualified for free and reduced lunch, whereas the national estimates are closer to 50%. And so, thinking about the ability of more resource schools to pivot into online instruction leads to very different experiences for those children. So just realizing that, at baseline in households where people were fairly well resourced, they were still encountering a lot of challenges. And so we can only imagine and extrapolate from these particular data here just how challenging the experience was for other families across the United States. So I know that's a lot. It provides you hopefully with a broad foundation, but then Robin and Jess and Christy are going to talk about some of the more specific implications of this, again, for academic, physical, and social emotional health.
Thank you so much, Dr. Breach. So I want to hand this over to Dr. Cotting, really to talk, to contextualize in some ways what we found in this research, and really thinking about, well, what is the research on digital learning? What do we know? And how might that help us kind of interpret what we have found in terms of our national survey? So Dr. Cotting.
Sure, and thank you for this chance to discuss the educational implications of school reentry options. I think far too little attention has been paid to the academic loss potential resulting from school closures. Phrases like generation lost have been used to describe the potential scope and devastation. And I feel like this is an important, frank conversation to have about the educational risks to children not returning to school in person in the fall. The decisions that we make now are going to send us down one path or another with lasting implications for children. And many of you may have seen the recommendations from the American Academy of Pediatrics, which strongly advocates that all policy considerations for the coming school year should start with a goal of having students physically present in school. You may also have seen other headlines that have permeated the news media that suggest remote instruction has been a failure or a complete disaster. So you may not be surprised to learn that there isn't a ton of data on digital learning in K-12 schooling, and it's certainly not as much as you might have anticipated. But we do know some things, and so I'm hoping to convey that information to you today. For example, we know that the existing data do not support a remote-only option for most students. We know that poor educational outcomes were found for students engaged in fully remote online charter schools that relied on asynchronous learning platforms. So that's an independent platform that Amy was referring to. And traditional classroom instruction was better. We also know from the Organization for Economic Cooperation and Development that countries in which 15-year-olds had more access to one-to-one computing actually resulted in lower international reading and math test scores. We also have some data from our initial school closures in the spring, and we know that truancy rates were around 20%, with some figures as high as 30%, particularly in the high school arena. So access to digital platforms was substantially limited in many ways, including according to socioeconomic status and whether you lived in a rural, urban, or suburban community. The infrastructure of the country simply doesn't support access to high-speed internet, and there are large gaps nationwide, and that's something that we have to recognize as we move into school reentry. In addition, there are concerns about data privacy and screen time, particularly with young children. We also know that the average ratio of computers per student across the nation is 1 to 5. So there are not enough computers without having some additional supports being provided by the school. And in addition, digital platforms are really challenging for many students to navigate. And I think we probably all experience that to some extent or another. And young children is one example. We do have existing data on computer-assisted instruction. Certainly that type of instruction has been around for a long time. And what we know from computer-assisted instruction is that there are small to moderate positive impacts on learning, but the benefits are more likely to be observed when used to supplement teacher-directed instruction. The same thing is true about tablet applications. It's important to recognize that we don't actually have much data on tablet applications, but the data we do have says that the benefit really comes when it's a supplement to teacher-directed instruction. When it comes to blended or hybrid learning opportunities, and this refers to the combination of in-person and remote schooling, outcomes are mixed. And again, we don't have a ton of data available. But compared to in-person teaching, we have some studies reporting positive findings and other studies reporting less positive findings. So that gives you some information on that digital learning landscape, and that's an important background context. I'm now going to pivot a little bit to talking about learning loss, or what you might have heard described as the COVID slide. So the COVID slide reflects learning loss in math and reading in particular from early school shutdowns. And what we know from these existing data is that it's expected to exceed typical summer slide. One projected outcome is that students will retain only 70% of reading content and 50% of math content. So that means they'll have lost about a third to a half of all of the learning that has occurred in the prior academic year. Other analyses have suggested that the average student will fall between 7 and 10 months behind. And struggling learners, of course, are going to experience more and persistent learning loss. We also know that learning loss has been reported to differ according to zip code, with students from lower and middle income areas faring worse than students from high income areas. So these are all really striking pieces of information, but it's also important to know that in the context. So when we had school closures, it was the last quarter of the school year, and that last quarter of the school year, students typically make fewer learning gains. The largest learning gains occur in the fall. So that makes school entry decisions in September really critical. So one of the things that Christy wanted us to make sure we talked about, as she mentioned earlier, was opportunities. So one of the things we know is that we can maybe learn something from, for example, private schools that may have implemented more direct instruction online. And although there are not formal studies, anecdotally, it appears that some private and parochial schools were able to provide hours of direct live synchronous instruction on a near daily basis. And after hearing what Amy had talked about, we know that this is not the same experience as what happened in public brick and mortar schools. We know from this that the most effective instructional practices include explicit teacher-directed instruction, opportunities for peer collaboration, as well as immediate, timely, and meaningful feedback with lots of opportunities to practice. So I think that does provide us an opportunity to innovate. And schools certainly did do that in the initial school closures, and they have opportunities to do so in this planning phase. So schools could provide differentiated instruction and personalized learning to bridge potential gaps. They could rigorously evaluate the web-based resources that they asked students to engage in to ensure high quality. And they could build opportunities in online spaces, such as the use of chat or breakout rooms. The bottom line, and Amy was referring to this earlier, is that schools need to provide rigorous, explicit instruction. And we know that this is best done in person, but it can be done through synchronous online learning experiences. And in order for that to work, we need to ensure that every student has access to sufficient high-speed internet, a device, and Wi-Fi, that schools can provide a learning management system with developed curriculum content and embedded assessment tools, and that schools can offer technical support to students and families. They may need to be prepared to conduct synchronous learning experiences through telephone or text in the case of not having access to online platforms, and use applications that translate information into multiple languages. During school closures, districts showed innovation, and they did so by partnering with internet providers or purchasing Wi-Fi hotspots to expand internet options. They also partnered with local community networks and television stations, which provided innovative learning experiences. And districts with teacher shortages were able to access available instructors from across the nation. When I look at and consider these risk-benefit ratios, from an education standpoint, the best option is to send children back to school physically. One source summed up the risk of not doing so in the word equity. There are lots of data to suggest that the impact of school closures will exacerbate known achievement gaps, and opportunity gaps have already occurred with culturally and linguistically diverse learners, students living in poverty, and students receiving special education services. And you heard Amy talk about what our sample illustrated in that regard. Students across the nation probably will experience all three schooling possibilities: in-person schooling, hybrid, and remote learning. And of course, the access to these different options will depend on level of community risk. The remote-only learning and teaching are likely a needed option for medically compromised teachers and students. So I want to end my part of the conversation by saying that if your child will be engaging in online learning, there are several ways that you can set your child up for success. The first is to find a quiet and separate physical space for work time and have all the supplies that a student needs available and ready. If physical spaces are not available, then using headsets can provide that separation. We also know that children need to have time to acclimate to the device that they are using, getting used to things like a mouse and keyboard, and also getting used to navigating tabs. There are some very rough guidelines that suggest 30 minutes to 1 hour of daily online instruction per subject area. And when we think about subject areas, we think about reading, writing, and math, so the basics. So that's appropriate and varies according to each group. The other really helpful thing is to develop consistent routines and schedules. So the school home day, and we use that phrase in my house, it was a school home day or a home day, might start and end the same way. Schedules might be created for the day. You could embed chores, outdoor time, and creative art and music time, so it mimics a typical in-person school day. And it's useful to start with academics, typically. Older children can be encouraged to use checklists to mark off assignments completed. And for younger children, you might encourage them to do their academics first. And once they've completed their work, they can have free time. And another option could be to alternate academic activities with preferred or choice activities. So once the first academic activity is complete, then they might have choice time. And then you can, put a time limit on that number of minutes for choice time and use timers and things to help them navigate back to the academic activities. In our household, we use a token economy. My 10-year-olds had to follow a set schedule each day. They earned points for doing so, as well as for being kind and respectful to one another. They could trade in the earned points on a daily basis for choosing what we had for dinner, getting a chore free pass, or extra screen time, and they could also save points and trade in later. So hopefully this gives you some information that will be helpful in terms of the academic arena. And with that, I'm going to turn things back to Jessica, who's going to talk about physical health.
Great, thanks, Robin. So in addition to the educational impact that COVID's having on children, our group has also been thinking about the impact on children's health behaviors, and particularly on their nutrition, their physical activity, and their screen time. We know that many kids are spending more time on screens, both between remote learning and also just the lack of childcare and the other structured activities that they had been engaged in before the COVID shutdowns. And our survey data supported these concerns. We heard from our parent participants, 79% of them said that their kids were on the screen doing non-learning activities more compared with before COVID, and 56% of the parents were concerned about this. 66% of the parents said their kids were playing video games, watching TV, and using a smartphone more during COVID compared with pre-COVID, and 43% of parents were concerned about this. I think a lot of parents feel badly about having their kids on the screen so much, and this may be in part because in recent years we've been so focused on reducing kids' screen time. As a parent, I find it very stressful to limit my own kids' screen time, but given all of the other stressors that we're dealing with right now, I've just kind of come to terms with the reality that I need to accept that for this constrained period of time, and it's not going to be forever, that my kids are just going to be on the screens more than I would like. And as long as they're safe on the screen, meaning they're viewing appropriate material and they're only interacting with people that I approve, then this is okay for right now. Apart from the screens, I am concerned that many kids are not getting enough physical activity during COVID. Even before COVID, researchers and practitioners who focus on kids' health were already concerned that many kids were not getting enough physical activity. And now that, that we're in this COVID shutdown era, we have new obstacles that get in the way of physical activity for kids. And there are a number of them. So between March and June, when schools were closed, kids missed daily recess, they missed their phys ed classes, after school activities were canceled. So my kids had the availability of participating in dance class via Zoom, which they chose not to do. Gymnastics was canceled, team sports, practices and games were all canceled. Playgrounds and parks are open now, but they were closed for a while. And even now, some parents have concerns about letting their kids play on the playgrounds. With the stay-at-home orders, many families didn't have the physical space for kids to run around and be active. And working parents have difficulty having time to supervise younger children playing outside. And then many kids are not in daycare or camp this summer, where physical activity is typically built into a large part of the schedule every day. So there are just a lot of barriers, and a lot of this has come down to additional burdens that have been placed on parents to find ways to help their kids to be physically active enough. So according to our survey data, we found that 43% of parents said their kids were exercising less during COVID compared with pre-COVID, and 31% were concerned about this. However, it was encouraging for us to see that 39% of parents in our survey reported that their kids were playing outside more during COVID. But 29% of parents said their kids were playing outside less during COVID. So we know that kids are on the screen more. Many kids may be getting less physical activity before COVID-19. But there are things that families can do to be active together, especially now that it's summer and it's easier to be outside. And this can include things like family walks, hikes, bike rides, and these are all really fun and safe ways to enjoy nature and just to be together as a family. And I think it's important for us to also remember that being active is important for both parents and kids to reduce stress and anxiety, and also to improve mood. So these physical activity opportunities are important for the mind and the body, and they're important for everyone. And I'm just going to take an opportunity to plug the Family Gym program. Family Gym is a free drop-in play-based program that Dean Shepa and I developed back in 2010. And it runs on Saturday mornings at 6 Boston Centers for Youth and Families, BCYF locations. Northeastern service learning students and volunteers staff Family Gym, and we are planning on having programming in the fall. We know from previous research that children increase their percent body fat in the summer compared to during the school year. These summer changes in body composition may be explained by something called the structured day hypothesis. And this means that when kids have less structure in their day, they are less physically active and they also snack more. So during COVID, this lack of structure is happening over many more months than the 10-week summer vacation that we typically have. And that's potentially concerning in terms of children's weight gain. On the positive side, in our survey, we did see parents respond that kids have been spending time cooking and also baking at home. So during COVID, there may be more intergenerational opportunities for parents and grandparents and other family members to teach kids cooking skills. And we didn't ask about this, but I think it's likely that many families are eating meals that are cooked at home more often than they were pre-COVID. So that's positive in terms of being able to control portion sizes and also just the amount of fat and sodium that we consume. So in summary, it's important to keep in mind there are particular challenges and barriers to children's physical activity that have been brought on by COVID, but there are also important opportunities to be active and to eat together as a family. There are so many stressors about COVID that we just can't control. But being able to take walks and bike rides and cook together are all enjoyable things that we can control and do safely together as a family. Plus, we can use these moments to help our kids form positive memories from the COVID era of their childhood. So I'm going to turn it over to Christy now, who's going to talk about the social and emotional impact of COVID on both kids as well as parents.
So thanks so much. And I do want us to be able to get to the Q&A because I know there are a lot of questions out there. So I'm going to sort of briefly go over this section. It could be a whole webinar in and of itself, but I encourage folks to bring in questions about mental health. We actually don't have any direct evidence at the moment on the impact of COVID-19 on mental health, but there is a lot of anecdotal and kind of correlational survey research to suggest that there's an impact. What we know from our data is that parents are incredibly concerned about stay-at-home orders, schooling from home, and the impact on their child's mental health. We found 70% of families expressed some level of concern that their child may have a social, emotional, behavioral challenge entering school in the fall. And this was striking because, as we said earlier, Dr. Breach talked about, only about a third of families had children who had a social, emotional, behavioral concern currently. So there's really a sense that kids are struggling with their mental health as a result of the circumstances that we've been put in. We look at CDC data, there has been some research with other infectious disease outbreaks, so thinking about SARS, that mental health symptoms do indeed spike in the context of these outbreaks. So it's important for us, obviously, to be looking at the signs that our children may be suffering and really recognizing that the signs that a young child may be having symptoms are obviously very different than a teenager in terms of how they're going to present, whether it's, you know, a young child having more tantrums, a teenager perhaps withdrawing more or engaging in more risk behavior. Some of the things that I think are really important to pay attention to is excessive worry. You know, if your child is worried about getting the virus, having nightmares about it, expressing a lot of concern about the future, losing friends, worry about going back to school. I can say for myself, my daughter has always had some kind of school anxiety. And so when we moved to schooling from home, she was thrilled because for her, she didn't have to deal with kind of the social interaction that comes from a normal school day. But then on the flip side of that, there is so much stress about the idea of going back to school because she will have been out so much longer than a normal summer break. So kids with, you know, school avoidance and school anxiety may have more difficulty transitioning in whatever type of educational circumstance we have in the fall. Obviously thinking about changes in sleep and eating patterns, difficulty concentrating, changes in mood, irritability in younger children, changes in thinking where your child may be hopeless or helpless, and then any kind of just general worsening of pre-existing mental health concerns is something we all want to look at. There's a little bit of data just recently that came out from some ERs, actually some research out of Rhode Island showing that there has been a pretty significant uptick in suicidal ideation in emergency rooms, especially among young people and teens. And there's discussion about, you know, teens being anxious about not having their school graduation, not having their prom, not sure what college is going to look like. And I think sometimes, you know, we sort of forget, you know, because many of us are at home with our families, we think, well, how could somebody feel lonely and isolated? But when you're feeling depressed, you can often feel alone in a room full of people, right? So it's something for us to keep an eye out for, especially because there is so much isolation that we have experienced in the context of this pandemic. I won't get too much into family violence. That's actually my area of research. And I have, I just wanted to say one thing, which is that, you know, schools are incredibly vital for identifying child abuse. You know, teachers, school personnel, school nurses, they are there, and they are oftentimes the first responders. And when children are schooling from home, there oftentimes isn't anybody to look in on what's going on. So this is really a significant concern. And there's also been a lot of media attention focused on domestic violence. And so this is something, again, we could spend an entire webinar talking about, but, you know, it's incredibly stressful for families to be home together. And when there is domestic violence already in the home, that can be exacerbated. And when there isn't domestic violence, sometimes it can emerge in that context. And so something we need to be thinking about. The other really interesting data that came out of our study that was not surprising to me is that it's not just about child mental health. Parents are struggling. So we were seeing about almost 70% of our parent respondents were saying that COVID-19 has negatively impacted their mental health. About 3/4 saying that they were feeling unhappy in the past week, half feeling depressed in the past week, and over 1/3 feeling helpless and like a failure. So with that, I really feel like it's important with this group to talk about strategies, what we can do to try and help each other, because if the parents are struggling, it is really difficult to support our kids, right? So, you know, this is not an exhaustive list of strategies, but, you know, one of the things that I think is really important, and Dr. Hoffman kind of alluded to this when she was talking about screen time, is, you know, really being kind to yourself during this time. It is normal to experience fear and worry and grief. There's so much uncertainty, right? And so, you know, sometimes we do have to let things go. And that can be really challenging when you're somebody who typically has everything together, right? And you're always kind of balancing those balls in the air. Right now, it is impossible really to balance all of those balls. And so some level of acceptance can be sometimes for some people kind of a healthy strategy to kind of help. The other piece is really trying to take things one day at a time. When you look forward to the fall, again, we don't know what's going to happen, and that uncertainty can kind of get that worry and anxiety going. And so really trying to have that focus on what can we do today and what can we do tomorrow, that can sometimes kind of ease some of that fear. Focusing on what you can control. This is something as a counselor that we talk about a lot, right? So much is going on right now that we can't control. What can we control? We can control getting outside. We can control playing a board game with our kids. What we can't control is this pandemic and what schools do in the fall. And so really trying to focus your thoughts on how to kind of make today better. Staying connected. Not surprisingly, that's been really difficult. But there are lots of folks that have, connected with, friends from high school that maybe they don't actually talk too much. Now they're, having a Zoom meet once a week. And, that can be really kind of fulfilling to have those connections when we're not able to be together. Cutting yourself some slack. There's an old sort of adage that people talk about in terms of, good enough parents doing, just trying to kind of be good enough for your child to be able to succeed. And I would say that there's so much truth to that, because kids actually learn a lot when we make mistakes, right? So it's an opportunity for our children to adapt and to develop skills to conquer little disappointments, right? So, you totally forgot about the Zoom meeting that they had to, get on at 12 and they missed the class. Oh, well. It's part of it. We just have to accept that in ourselves and allow for a little bit of flexibility. Talk. Family communication is so powerful. We use it in all of our prevention interventions. When you open up those lines of communication, when your child is young, when they get to the stage where they're an adolescent and they want nothing to do with you, you have that little door open where they can come to you when they are having those hopeless feelings. Family communication is incredibly powerful, and it can be difficult, especially around sensitive topics, but it's something that I really, really think is important. And lastly, I will just say that counseling is a great prevention tool. You do not have to wait until we are struggling to the point where we can't get out of bed. Counselors are out there and happy to have a session or two. And when you're just starting to struggle, when you're just starting to feel like, I just don't know if I can handle this, it's a great time to have a small intervention that could potentially have a really big impact. And right now with telemedicine, there are so many opportunities. And I think that's what's really exciting. We have a lot of research to show that telemedicine is just as effective in counseling as in-person counseling. So it is something that I think has been an opportunity that has come to the fore with this pandemic, is that now telemedicine is being reimbursed by many insurance companies, and it is now something that can reach folks who maybe wouldn't be able to reach counseling otherwise, whether that's because they don't have transportation, because they live in a rural area, et cetera. So I think there's some good news potentially. So with that, I want to kind of hand over our discussion to Crosby, because we would love to dig into some of the questions that we're getting in the chat. So Crosby?
Thanks, Christy. Hi all, and thanks so much for submitting questions, comments. Please feel free to keep them coming. We've got a lively chat going here, and some of the questions have been answered, but I'll just kind of recap for the folks who are on the phone. The first one was, there's been a couple of requests for copies or just to be able to see the statistics that Amy shared at the beginning of the presentation. And yes, the presenters are working on a report that should be forthcoming. Additionally, as you've all registered, we have your contact info and can circulate when the time comes. Next, I'm gonna call on Jenny Gormley. She has a question about parents if parents had synchronous or asynchronous learning connection with instructional support personnel as well. Jenny, do you want to add anything there?
Hi, thank you, Crosby, and thank you, presenters, colleagues. Some of us have worked together before. Yeah, I was just really interested to hear about the survey, and in particular, your point about synchronous versus asynchronous, because we were hearing from our school nurses, our colleagues, that they were providing synchronous opportunities to connect with students. Some of it was, formal health teaching about topics, nutrition, physical activity, yoga, a stress relief. Some of them were collaborating with their counselors or their health teachers, coming in the end of a classroom session with a classroom teacher to check in. Some of it was basic hand washing, especially in the beginning when schools were closing. And I just, we're getting some of that feedback. I'm not sure, we don't have numbers or percentages, but we've had a number of school nurses, not only in our state, Massachusetts, but across the country, talk to us about how beneficial it was to be able to connect this way. Some of it was asynchronous also through Google Sites or Google Chats and emails and so forth, but definitely some were doing live connections with students.
And that was one of those things that, you put out a survey, you spend all this time to get all the questions in, you put it out and you're like, oh, why didn't we ask that? Why didn't we ask that? I mean, it was definitely one of those things that we had asked parents about academic subjects in terms of instruction, and we'd ask them actually about non-academic subjects as well. So, did their child, for example, receive any instruction or supports with regard to wellness or self-management, these types of constructs, social-emotional constructs. And we did, though, have a fair number of people when there was another category at the bottom who had filled in health. Like, I think that was one of the more popular ones that had been filled in, was in terms of health and wellness. So it was clear that there were at least a small chunk of people within that sample who were receiving those types of supports. It's just the problem that it's only the people who elected and thought, oh, let me add health to what you've already offered us, that put it there, so we don't have a really standardized number across the sample to know how frequent it was. But I've certainly heard about that with school psychologists too, trainer of school psychologists. We have our students in the schools. Many of them were able to continue to have direct communication with students by going into a classroom and delivering a social emotional learning lesson or something like that. So I think it's great that there were these other opportunities to have that direct connection with kids.
If I may add one thing, Amy, to that, is that we did hear from school nurses that there was concern among administrators not to overwhelm parents with too many meetings, too many sessions, too many requirements. So I think that they were feeling very concerned and mindful about the demands that they were placing on families.
Yeah, I think, and also, with some of the families who we knew, for example, didn't have access to technology in the same way that some schools also took the approach of saying, well, if not everybody can access it, is it fair to be offering it? I think clearly from the comments, at least, that we were getting from parents in this sample, that they were saying, we wish that there were more opportunities to connect directly. I think by May and June, people were a little bit overwhelmed with Zoom. We all can admit that. But I think even just having those opportunities available, whether it's, check-ins or whatnot, just so that there's those opportunities to directly connect.
I just wanted to add on to what Amy was saying about school psychologists being able to provide supports and mental health services remotely, and the fact that we had students who were in practica and internship placements during these periods of school closure, and they were supported by their field supervisors and university supervisors to be able to also fill these roles and these supports for kids were really important training opportunities for our students who, as school psychology students, probably never thought that they would be delivering telehealth during their practicum and internship.
All right, so thanks all. I'm gonna kind of combine two questions here, and I invite Kay Hackett and Daisy Monsalve, if you want to add to this, please feel free. Both their questions get at the point of schooling in English, and then for both students and parents who aren't, English isn't their first language, and if this group could just kind of talk about understanding that this survey was administered in English, but what are you seeing in terms of our schools providing instruction in languages other than English, both from the perspective of parents and their children?
Yeah, so I'm happy to. I was editing down my content a little bit, and so I only touched on this a little bit, but we definitely know that access to instruction was virtually non-existent, for example, for English learners and for children with disabilities. That's just a fact of what happened during school closures, and that's probably why I tried to keep that strong language in about learning loss throughout the conversations that I was talking about. So this is a very important topic. What we saw in some of the possible innovations is that we have to be able to ensure that synchronous learning opportunities provide, I mentioned that there is applications that schools can use to translate content into multiple languages, and that's a necessary thing that schools are gonna have to do in order to give kids access, and parents and caregivers access who are supposed to be helping their children. There's also been a lot of recommendations to provide phone and text options because it's easier to navigate those platforms in order to provide multiple linguistic opportunities. So those are a couple of things that I have read and seen as necessary adjustments to continue remote online instruction in the fall.
So our next question or comment is from Georgia Looney, and she notes that she has 2 children, one in public school, one in private school, and she just comments on the difference in experience across the child who's in public school and versus private school, and if this group could maybe address any differences that you've seen there and strategies or ways to deal with that.
Yeah, it's one of those things that we are hoping, like I said, in terms of diving into the data a little bit more. We had a smaller percentage of parents who were reporting that their children were in private schools prior to the closures, but we will be able to look at some of those differences that exist. I think certainly just from what we've heard anecdotally, that there were a lot of private schools that just had the infrastructure to be able to switch over quickly. Some of the comments from parents in the sample talked about, one of the more helpful things being the fact that they already had a Google Classroom site as an example. And so they were used to using that technology. They only had to go to one place to find information, and that remained consistent. So it made that transition much smoother. So I think that's the big challenge for schools right now, and thinking about, at some point in the fall, if not immediately, eventually probably needing to go to remote learning again, is making sure that those systems, now that we have a little bit more time to plan, that was the difficulty obviously in the spring, as things happen so quickly, but we have a little bit more time to plan in terms of those systems, and if we can get those systems in place, hopefully that helps a little bit in that transition.
All right, so we probably have time for 1 or 2 more questions. I'm going to jump down to Tia Keck has a question about masks, and I know that this is, obviously something that is very much on all of our minds, and just thinking about, the recommendation of wearing a mask and how that impacts children, and then also teachers in the classroom.
It's a great question, because the question is, is there any research out there that has looked at what the effect of masks might be on kids' language development? We think about this with young kids who are just learning language and not being able to see people's mouths moving, or social emotional awareness in terms of understanding facial expressions. And as far as I know, the thing is that I don't think that there is any research that's out there, because this is such a new phenomenon. I mean, I'm sure that there are studies that are going to be happening now to look at this a little bit more. But I think in a lot of dimensions of practice, the way that things are going to shift with some of these guidelines, we just don't know yet what the impact is going to be. And so I know that Robin had commented on the fact that a lot of people, or maybe it was Jess, I can't remember, a lot of people have been talking about these masks that have like a clear opening so that you're at least able to see the person's mouth, that would be a helpful thing. And I know a lot of teachers groups are talking about that, but it will be interesting to see what the impacts are.
And so I think, so our final question is from Jenny Gormley, and she notes, and Jenny, please feel free to unmute yourself, but speaking of masks, how does this impact school culture, and if masks are required with exceptions, who in school are responsible for implementation?
We taught masks as a huge topic, and school nurses have been very involved with this in terms of what type of masks, who's wearing them, what is provided by the school, what are parents providing, what are the guidelines, and so on. But I'm thinking of it in terms of the culture, you know, the feeling in the school. This is new for our culture, maybe not so much in other cultures, but what is the impact on how students are relating to each other? And another question is, you know, the sort of the discipline. I don't mean to go the discipline route, but what happens when students aren't wearing their masks? Because we know that not all students, you know, for a variety of reasons, will go with the program. So I'm just raising it, maybe rhetorical at this point, but I'm curious if you have some ideas.
I think, so coming from more of a mental health perspective, I think, you know, one of the things is preparing as a family, you know, thinking about younger kids in terms of getting comfortable with masks, right? And sort of like the way that we approach mask wearing is something that our kids are seeing, right? And so spending time kind of getting kids used to wearing the masks in smaller increments, perhaps providing some incentives for them to do so, and sort of getting them into that rhythm well before they're in that position of being in a school, being required to wear it for the full day or half day or whatever the setup is. You know, I think it definitely helps to start now. And I would say, you know, the same is true for teenagers, but obviously you're approaching it in a very, very different way.
I was going to say it definitely is a challenge in terms of just thinking about the variability with which families have had these conversations with their kids about masks. And I just, you know, from a personal perspective, was thinking about, I have a 3.5-year-old who knows, like, if she's going to, you know, be out near people, she wears the mask and she knows to move away. And she talks about like how things will be when people we don't know are feeling better again. Like, she understands the general concepts, but I know in talking to some of her friends' parents from daycare that they haven't even told them anything about it. They just think that they've been on vacation during this period of time. And so I think just the differences in level of knowledge about what's going on, and thinking about what sort of psychoeducation has to happen at the school, probably just to inform kids of the basics of what's happening, because I don't think we can assume that all families have had those conversations with kids to understand what it is that we're going through. And obviously, you know, it has to be developmentally appropriate, but the kids need to understand exactly why they're being asked to wear the masks too, because I think there are a lot of kids that don't necessarily understand that at this point.
And the other thing to think about is that people have different values that they place on wearing masks and the ability of the mask to be useful or not. And when school is saying one thing and the family has a different stance on it, then when you talk about you know, cultures coming into conflict with each other, this could be an opportunity for family school you know, conflict. So navigating that is going to be another element to be mindful of.
All right, so we are at time. Thank you all so much for joining us. I'm going to transition it back to our speakers just if they want to provide any final remarks, but I'm going to post the registration link for our next webinar in the series in the chat. And again, thank you all so much for joining. It's been a really interesting, informative conversation.
I just want to say thank you to everyone who has signed on today. You know, we're just really scratching the surface of this topic, but it's so great to get your questions and really, you know, start thinking about this together. So we hope, as we said, we're trying to summarize our research and create some content that we can share. And so we hope to do that soon in the future, so you can hear a little bit more about some of those sub-analyses that are relevant to some of the questions we were talking about today.
I know we're over time, so I just wanted to say thank you. I really enjoyed our time together today, and I really appreciate your interest in this topic, and our report will be forthcoming, so look out for it.
Thanks again, everybody. Have a great day.